Welcome back. Today we're diving into differential reinforcement, one of the most tested concepts on the BCBA exam, and honestly, one of the most useful tools in real clinical work. If you've ever wondered, when do I use DRA? When is DRO better? And what on earth is the difference between DRL and DRD? This video will finally make everything clear. And remember, everything you see today is part of the full prep system at bcbmockexam.com, where we break down confusing exam terms into clear, simple understanding. Differential reinforcement is a high-frequency topic on the BCBA exam, appearing in concept questions, scenarios, and treatment design. Many test takers mix up DRO, DRI, DRA, or DRL versus DRH versus DRD. Our goal today is simple: help you quickly identify DR procedures, avoid common traps, and apply them correctly in intervention design. Always ask yourself on the exam, what behavior gets reinforced and what happens to the others? If you can answer that, you've mastered the core of DR questions. Differential reinforcement simply means you reinforce one set of behaviors and stop reinforcing another set. In other words, you decide what you want more of and what you want less of. Look at the left side of the slide: behaviors that get reinforcement, desired behaviors, the behaviors we actively want to increase, like raising a hand, staying on task, or using calm words. Alternative behaviors, not perfect yet, but a better option than the problem behavior and often serving the same function, such as using a break card instead of screaming. Incompatible behaviors, behaviors that cannot happen at the same time as the problem behavior. For example, sitting in a seat is incompatible with wandering. Now the right side: behaviors that do not get reinforcement. Problem behaviors, things like tantrums, aggression, refusal. Undesired behaviors, not dangerous, but not helpful, like calling out repeatedly. Excessive behaviors, appropriate behaviors that occur too often, such as asking nonstop questions. And here's the key test A idea: ask yourself, what gets reinforcement and what happens to everything else? Once you can identify what is being reinforced and what is being withheld, the different DR procedures, DRO, DRA, DRI, DRL, become much easier to tell apart. 2 dimensions to watch in questions. This slide gives you a powerful exam strategy. Whenever you see a differential reinforcement question, analyze it along 2 dimensions. Dimension 1 asks, what is reinforcement tied to? If reinforcement is delivered for the absence of the behavior, that's DRO. If it's tied to an alternative or incompatible behavior, you're in DRI or DRA territory. If it's based on how often the behavior occurs, its rate, you should be thinking DRL for low rates, DRH for high rates, or DRD for diminishing total occurrences. Dimension 2 asks about the time or rate criteria in the wording. Phrases like within 5 minutes point to time-based rules. No more than X times signals a maximum limit, and at least Y times signals a minimum requirement. The key exam move is to quickly lock in both dimensions. What earns reinforcement, and what is the time or count rule? Once you train yourself to scan every DR question this way, it becomes much easier to match the scenario to the correct procedure. If you want more slides, walkthrough videos, and full mock exams that use this exact style of reasoning, let's jump into the specific procedures, starting with DRO, differential reinforcement of other behavior. DRO is interesting because we reinforce the absence of a target behavior. If the behavior does not occur for a set amount of time, reinforcement comes in. We're not reinforcing a specific replacement, just the absence. Imagine a learner who throws items. In a DRO, if they go 2 minutes without throwing, they get reinforcement. They don't have to do anything special. They just have to not do the problem behavior. This is why DRO can work quickly but also needs careful planning, because we're not teaching a replacement behavior. DRO is great when you need rapid reduction of a dangerous or disruptive behavior, but it's not ideal if the learner needs a specific replacement skill. It's most effective when the behavior happens frequently and is easy to observe. Just remember, DRO equals reinforced 0 occurrences. Next up is DRI, differential reinforcement of incompatible behavior. This one's pretty intuitive. You reinforce a behavior that cannot happen at the same time as the problem behavior. The 2 behaviors must literally be incompatible. They cannot physically co-occur. Think of it this way. You can't hit and have your hands in your pockets at the same time. You can't run and stand still at the same time. You can't yell and whisper at the same time. When you reinforce something incompatible, you automatically reduce the problem behavior. DRI is great for behaviors with a clear physical opposite. If a behavior is dangerous, like hitting or running, reinforcing an incompatible behavior can be a quick and safe solution. It's often more targeted than DRO because you're teaching an alternative response. Now we move to one of the most commonly used strategies, DRA, Differential Reinforcement of Alternative Behavior. This might be the most practical and flexible of all the DR procedures. Instead of picking an incompatible behavior, we pick a functionally appropriate alternative. If a student screams to get a break, you reinforce requesting a break. If they grab toys from others, you reinforce asking for a turn. DRA is all about, what would be a better way for you to get what you want? It's aligned with the function of the behavior. Use DRA when the learner needs a communication or social replacement skill. Because you're teaching an appropriate alternative that still meets the learner's needs, you get behavior change that actually lasts, not just quick suppression. DRI versus DRA. Quick comparison on this slide, we're cleaning up one of the most common BCBA exam confusions, DRI versus DRA. Both procedures have two things in common. You reinforce a different, appropriate behavior, and you withhold reinforcement for the problem behavior. The difference is where the exam likes to trick you. With DRI, the key focus is physical incompatibility. The new behavior literally cannot happen at the same time as the problem behavior. If a learner is hand flapping, you might reinforce keeping hands in pockets or holding a fidget. You can't flap and keep your hands in pockets at the same time. With DRA, the focus is function equivalence. You're reinforcing an alternative behavior that gets the same outcome in a better way. Instead of screaming for attention, you reinforce raising a hand or saying, "Excuse me." On test day, use the exam tip at the bottom of the slide. If the question emphasizes that the new behavior is physically incompatible with the problem behavior, think DRI. If it emphasizes the same function or replacement response, think DRA. DRL, Differential Reinforcement of Low Rates. Now, let's look at DRL, Differential Reinforcement of Low Rates. The definition here is that you reinforce the behavior when it occurs at a lower rate than some criterion. So the behavior is okay in moderation, but right now it's happening too often. In the example on the slide, a student asks 20 questions per class. The teacher sets a DRL criterion. Reinforce if the student asks 5 or fewer questions. The goal is not to eliminate the behavior, but to reduce its frequency and keep it at a manageable level. The graph shows how DRL works. You're reinforcing responding when it stays under that fixed criterion line. We use DRL when the behavior is acceptable or even desirable in small amounts. Things like questions, snacks, jokes, social interactions. But it's happening so often that it becomes disruptive. On the exam, whenever you see acceptable behavior, just too frequent, and a rule like no more than X times, that should immediately make you think DRL. Let's move on to the high rate procedures. DRH, Differential Reinforcement of High Rates, is all about increasing a behavior that is too low. Reinforcement is delivered when the learner performs a behavior at or above a target rate. For example, if a student usually completes only 2 math problems in 10 minutes, you might reinforce completing 5. DRH pushes the rate upward. It's commonly used in skills like work productivity, reading fluency, or social initiations. Now DRD, Differential Reinforcement of Diminishing Rates. This one aims to gradually reduce the frequency of a behavior, but not eliminate it. It's perfect for behaviors that are not inappropriate, but happen too often. Things like asking for reassurance too often, using too many bathroom breaks, or even overeating. With DRD, you reinforce when the behavior happens fewer times than a criterion, and that criterion slowly decreases. This slide is your quick reference guide for all the rate-based differential reinforcement procedures, DRL, DRH, and DRD. These 3 often show up in BCBA exam scenarios, and the test loves to see whether you truly understand the goal plus criterion relationship. So let's break it down clearly. DRL, Differential Reinforcement of Low Rates, is used when the behavior is acceptable but happening too often. You're reducing frequency while keeping the behavior. The criterion is a fixed low rate limit. like no more than 3 questions per class. You'll see this with excessive joking, over-responding, or too many requests. DRH, differential reinforcement of high rates, is the opposite. The goal is to increase the rate of a desirable behavior. Instead of limiting responding, you set a minimum requirement such as at least 5 correct answers or at least 4 initiations. This is common for academic responding or social engagement goals. DRD, differential reinforcement of diminishing rates, looks similar to DRL but includes progressive change over time. The criterion is not fixed. Week 1, no more than 10. Week 2, no more than 8, and so on. It's built for systematically reducing excessive behavior in planned phases. The exam tip box at the bottom tells you exactly how to pick the right one. If the criterion stays low and stable, that's DRL. If the criterion gradually decreases, that's DRD. And if the goal is to speed up or increase behavior, that's DRH. Memorize this logic, and when you see those time-based or frequency-based rules in a vignette, you'll instantly know which DR procedure the exam is testing. Now we're going to put everything we've learned into practice with a rapid-fire identification exercise, because the BCBA exam absolutely loves giving you short scenarios and asking, which DR procedure is this? Let's walk through each example and highlight why the answer fits. In item 1, the student normally answers 15 times, but now gets reinforced only if responses stay under 5. That is a classic DRL, because the behavior is acceptable but needs to occur less often at a fixed low-rate limit. Item 2 is a textbook DRO because the learner earns a break only if the problem behavior, hitting, does not occur at all during a time interval, and the timer resets if it happens. Item 3 is DRI because the replacement behavior, holding the ball with 2 hands, is physically incompatible with hand flapping. In item 4, notice the numbers change weekly, 30 to 25 to 20. That gradual reduction in the response limit tells you it's DRD, differential reinforcement of diminishing rates. Item 5 is DRH. The learner must produce at least 8 on-topic responses, meaning we're increasing the rate of a desirable behavior. And finally, item 6 shows a functional replacement. Screaming for snacks is replaced by an appropriate request, so that's DRA. The key to mastering these is training your brain to scan for the reinforcement rule first. Is it tied to 0 behavior, an alternative behavior, or a rate requirement? That single question often solves the entire item. This slide is all about protecting you from the classic mistakes that trip people up on the BCBA exam. Let's start with the 3 common traps on the left. The first one is replacement behavior misidentification. Many people label something as DRA just because it's a new behavior, but they forget to check whether it serves the same function. If the replacement doesn't achieve the same outcome, it is not DRA. The second trap is DRO versus extinction confusion. DRO still includes reinforcement. It's reinforcement for the absence of behavior. Extinction is no reinforcement at all. If the scenario provides reinforcement for not doing the behavior, it's DRO, not extinction. The third trap is rate criterion misunderstanding, which happens when you miss whether the frequency rule is fixed or changing over time. If the limit gradually decreases, that's DRD, not DRL. Now let's move to the strategy tips on the right. First, highlight what earns reinforcement. Every time you read a question, ask yourself, what exactly gets reinforced in this scenario? Second, circle keywords such as no more than, at least, does not occur, cannot happen at the same time. These phrases are huge clues for identifying DR procedures. And the memory aid at the bottom is something I want you to burn into your brain. On the exam, always ask, what behavior gets reinforcement? What happens to everything else? If you train your brain to answer those 2 questions automatically, you'll avoid almost every trap on this list. Here's our quick summary. DRO equals reinforce 0 occurrences. DRI equals reinforce a behavior that can't happen at the same time. DRA equals reinforce a functional alternative. DRH equals increase rates. DRD equals reduce gradually. DRL equals space behavior out. If you understand these differences, you'll be ready for almost any DR question the exam throws at you. Before you go, remember this. Mastering concepts like differential reinforcement is exactly how you build real exam confidence. And that's why we created BCBMockexam.com. If you want full-length mock exams, detailed explanations, flashcards, and lecture-style videos just like this one, you'll find everything there. Don't leave your exam to chance. Prepare with tools that are built by BCBAs for future BCBAs.